Struggling with weight can impact every part of your health, but there is help. Dr. Mohammed Elshamy from Carle Health joins us to talk about bariatric surgery, who it's for, and how it can lead to lasting change. That's what's next on Being Well.
This is you, and you are why we do what we do. Because the way you feel matters. Sarah Bush Lincoln, trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle is always at the forefront to help you thrive.
Thank you for joining us for another episode of WEIU-TV's Being Well. I'm your host, Lacey Spence, and today we're going to be talking about getting our health right and bariatrics. And to join us for this conversation, we have a new guest to the show. Joining us from Carle Health, we've got Dr. Mohammed Elshamy. Welcome to Being Well.
Thank you. Thank you for having me. It's a pleasure.
Of course. We love for our viewers to be able to get to know who they're listening and learning from. Can you please introduce yourself and tell us a little bit about you?
Hi, I'm Dr. Mohammed Elshamy. I'm originally from Egypt.
Okay.
I came to the United States after finishing medical school and did my training in general surgery at the Cleveland Clinic in Ohio, followed by a specialized fellowship training in bariatric surgery in New York. I recently moved to the Champaign area to work with Carle Health and provide general surgery and bariatric surgery services to the area, and I'm very happy to be part of this community and helping take care of our patients.
Wonderful. Well, today we want to talk about being able to take your life and your health back through bariatrics. So if I'm somebody who's maybe never heard the word, what does it mean in general?
So bariatrics means weight loss surgery for patients who have struggled with excess weight. A lot of our patients have struggled with excess weight for a long part of their life, with multiple attempts at weight loss over the years. A lot of them may be partially successful or unsuccessful, who eventually are interested in a solution that is a little bit more strong and a little bit more permanent for them to be able to manage their weight and live healthier and happier lives.
Sure, and there's nothing wrong with, needing a little extra help, needing this tool in your toolbox. So when it comes to bariatric surgery, what makes somebody a good candidate for it?
Absolutely. As you mentioned, there's absolutely nothing wrong with struggling for a while.
Yeah.
And what we do is we sit down with our patient and kind of understand who they are, understand what I do when I see patients for the first time is understand their goals, what they're hoping to achieve out of this and how we can help them.
Okay.
I think a patient who is a good patient is someone that is committed to making significant changes.
Sure.
We see a lot of patients who have a lot of medical issues or struggles with their excess weight, whether that's mobility issues, musculoskeletal issues, not being able to do the things that they love doing because of their excess weight, or having a lot of medical problems like diabetes, high blood pressure. Some patients even have liver disease or fatty liver or kidney disease as a result of excess weight. And bariatric surgery can help with that and can help with improving their medical comorbidities like their diabetes and their high blood pressure.
And so this is almost kind of like bringing in the bigger guns, because this isn't for just losing the extra 5 to 10 pounds so that your pants fit better. This is like a significant amount of weight you're wanting to lose. Is this typically for folks who are maybe in the obese category?
Absolutely.
Okay.
So the indications for bariatric surgery are a body mass index, a BMI, greater than 40, or a body mass index of 35 with medical comorbidities related to obesity, such as diabetes or high blood pressure, or sleep apnea.
So having all of those things culminate together, we decided that I fall into the category for this surgery. Then what? Because I've gathered that there's several different options when it comes to surgical intervention. So which one would you like to discuss first?
Yeah, absolutely. First, I'd like to discuss our approach at Carle for bariatric surgery and for weight loss in general.
Okay.
So what happens is when a patient is referred to us, we sit down with them, we meet them, and we go over all different aspects of their life and their medical issues. And we come up together with an individualized plan for that patient. So we go over things such as, first of all, understanding their medical problems, how we can better address them, understanding their current relationship to
Would it be exercise or
yeah,
food?
exactly.
Or?
Their current relationship to exercise, to food, their lifestyle.
Yeah.
And we start working with them on lifestyle modifications that they can do. We start by teaching them how to read food labels, for example, how to build a balanced diet, how to exercise and what kind of exercises they can do in order to live a healthier and better life.
So you don't just jump straight into getting surgery.
No, we don't.
You want to start those tactics first.
Exactly, because bariatric surgery is a lifelong change, and we want to make sure that people are going to be successful after the surgery.
Absolutely.
So what we want to see is we want them to be able to lose some weight even before undergoing the operation, and enacting these lifestyle modifications and changes so that they can keep on with them after surgery and keep on with them for the remainder of a healthy and successful life.
So I'm sure that might help debunk maybe a rumor that, you know, you get this surgery and that's it. That's your quick fix. You have to do nothing else. It's just gonna, you know, the weight's just gonna fall off. Not true.
Absolutely. I think our patients are definitely very committed individuals who put a lot of time and a lot of effort into the process. I think definitely the surgery is a big part of it, but the patient is the one that's doing all of the work. And you know, we've had a lot of you know, great people who've really changed their life completely with these operations.
Well, we've talked about doing the surgery, so let's dive into some of those surgery options. There's laparoscopic gastric bypass. So for the folks who have no idea what these are, what's happening inside my body?
Yeah, absolutely. Let me start by saying that all of the surgeries that we do are done laparoscopically or in a minimally invasive fashion.
Ooh, smaller scars.
Smaller scars.
Love that.
Only about one night stay in the hospital just to check up on them.
Sure.
But the surgery isn't any more different than, say, a gallbladder or an appendix surgery in terms of the small scars that we use.
Okay.
The first operation is the gastric bypass that you mentioned. What we do is we fashion a small-sized gastric pouch or a small stomach from the whole stomach. And then we reroute or detour the intestines by making some connections so the food doesn't pass through all of them. This leads to weight loss.
Okay.
This operation is very safe, very effective, and we've been doing it for many years with really good success.
And just so maybe I understand, when you're making the stomach smaller, is that something that as you are overeating over time, you've stretched that stomach?
No, so your stomach is the same size.
Okay.
What we do is we only use a portion of the stomach as part of your reservoir for food.
Okay.
But the remainder of the stomach stays in place in the body. Nothing is removed in this operation.
And then with that, so does that make me feel fuller faster?
Exactly.
Okay.
So that smaller stomach pouch makes you feel fuller faster. And also that bypass or that detour of the intestines inhibits food from passing through all of your intestinal length, which leads to some further weight loss.
Gotcha. And you mentioned the one-night hospital stay just to make sure things are going okay. Is part of that making sure that like I can still have a bowel movement or?
Yeah, usually bowel movements aren't something that we are too concerned about after the surgery.
Okay.
But the most important thing is to make sure that you're able to drink, not have any really bad nausea, vomiting, or problems like that. About 95 or 98% of people go home the following day by noon even, without any issues at all.
Perfect. I love the idea of not having to stay in the hospital any longer than I have to. Get back into my comfortable environment to heal in peace. So the next surgery option I've got on my list here, laparoscopic sleeve. So different from the first option. What makes it different?
Two things make it different. The first thing is what we do is we remove about 75% of the stomach.
Oh.
So
you're taking it out.
So we're taking
not
it out.
rerouting.
Not rerouting on this surgery.
Okay.
So you can imagine that your stomach is the size and shape of, say, maybe a football.
Okay.
What we do is we end up removing about 75% of the stomach and making it long and skinny like a banana.
Okay.
So that decreases the volume of the stomach, and it also affects hunger hormones in the body. So hormones that trigger your brain to feel hungry or full. There isn't any rerouting of the intestines. So this operation is definitely a little bit faster, right? A little bit less operating time, but also equally safe and equally effective.
And so if I'm a patient and, we've discussed all of these options, what would make me maybe a better candidate for one over the other, or?
Yeah, absolutely. Both options are really good for weight loss. The gastric bypass, because of that rerouting, is a little bit stronger. So if you're looking for the more stronger operation weight loss wise, the gastric bypass would be the one for you. The gastric bypass also helps if you have symptoms of acid reflux, which we see a lot of.
Okay.
So if you have acid reflux, the gastric bypass really helps eliminate those symptoms. So for example, if you're taking a lot of antacid medications or having a lot of struggles when you eat different foods, the gastric bypass helps. And people even get off of their antacids after that surgery sometimes.
Okay.
But at the end of the day, what my approach with patients is everyone that has come to us for bariatric surgery has done their research, has done their homework.
Yeah.
They've thought about this for a long time. And each person has an idea of what surgery they're interested in based on the research, based on talking to friends, family members that may have had one or the other done. And as long as there's no medical reasons or issues for one versus the other, after presenting all the information that, like we did here today, I let the patient choose what they're more comfortable with. Because at the end of the day, I want that every person to be comfortable with the changes that are happening inside their body.
Yeah, having an active role in your own health obviously plays a huge difference. So let's say I've gone through one of these surgeries. Now comes life after bypass or the sleeve. So what's next for me?
So right after the surgery, so it's an exciting time. You're gonna have a lot of weight loss. The weight loss happens usually in the first about 18 months. And people notice the changes to their health right away.
Okay.
So what happens is the medication, so for example, if you have medical issues like diabetes or high blood pressure, you're starting to make positive changes in terms of less medications that you needed. And that can happen right away. And patients that come back and see us for follow-ups, we notice that they are able to be more active, they're able to be more fit, they're able to do more in their lives, just with the initial steps of weight loss in the first 3 to 6 months.
Sure.
But overall, after the surgery, we have them on a softer diet that helps with their digestion, right? All these operations that we do that are changing the configuration of your digestive tract. Essentially, it's a diet that helps them take it easy for a little bit. So they're going to be on liquids for a couple of weeks, and then softer foods, and eventually in about a couple months' time, they're back to eating normal consistency food. But throughout this time, they're making changes. Portion sizes.
Big one.
Focusing on protein intake, avoiding carbs, avoiding fats, all the stuff that we talked about, and they've already made these changes from before the surgery as part of these lifestyle modifications. We make sure that the patients are taking their vitamins to prevent any problems with malnutrition.
Yeah.
And we want to see our patients. We see them back at set intervals. They're pretty close together, about every couple weeks, couple months for the first, say, about 6 months. But after that, it spreads out, and we're only seeing them once a year. Again, to make sure that they're doing well and not having any issues or problems.
Absolutely. Well, and not to, not to scare people, but to inform, what challenges are there post-surgery? I imagine, I've just heard from friends who've had the procedure, maybe they've lost some hair.
Yeah.
And it's minimal. It's a trade-off. You're getting your life back, your health back. Challenges that are worth it, but what can they expect that, might not make the whole thing, easy breezy?
Yeah. Like I said, sometimes some changes happen with your diet, right?
Yeah.
So it takes time to acclimate, to kind of learn what works well with your body, what doesn't, okay? And to get back to eating a full, normal consistency type diet. But after a couple of months, most people don't have any major issues. You mentioned some of that hair loss. That does happen, and that is a natural part of losing that weight. But with making sure that you take vitamins and have good, proper nutrition with high protein, really minimizes these types of issues. After significant weight loss, some people may have some issues with excess skin.
Okay.
That's a good thing. That means that they've lost all that extra body weight. And in that case, we work with our plastic surgery department, referring patients over if they do run into any of these issues in the future.
And again, if those comorbidities are going down, the diabetes is getting under control and whatever, a little vanity with some loose skin is quite the price to pay. Like, it's so worth it.
It is, absolutely, absolutely. And I've been fortunate enough to be in the community here for a couple of years now, and I'm seeing my patients who are 1.5 or 2 years out, who they look completely different when I see them. I barely even recognize them sometimes.
Wow.
And people are so happy with the changes that they see in themselves, with not needing to be on diabetes medications, for example, anymore, or being able to go back and do the things that they love and they always wanted to do.
Being back into their, pickleball or
exactly.
their, pick up softball league or whatever it is.
Exactly.
They're getting their life back.
Getting their life back, exactly.
Well, we've talked through a lot of the surgical options. I also don't want to miss out talking about GLP-1 medications. They've kind of been the talk of the town the last, couple years. So what's your take? What do you have to add to the conversation? I
think that these medications are a great option for patients who want to try something that is definitely effective in weight loss. Now, compared to surgery, the range of weight loss is a lot less. Right?
Okay.
So that would be someone who, for example, wants to lose 15, 20, maybe 30 pounds. That would be a really good option for that patient. If a patient is more interested in really strong weight loss, so say someone who weighs 380, 400 pounds, and they really want to lose 100 pounds to get them back to a healthy weight, those medications probably aren't going to be strong enough for them. I think what these medications have done, the most important thing they've done, is that they've brought, like you said, that discussion of obesity, discussion of excess weight, discussion of there is a solution, there is something that could be done. They've brought that into the forefront of our society right now. And they've gotten people interested in talking to the doctor about their weight and going to the doc and saying, I I've heard of these medications. I'm interested in doing something for my excess weight and maybe trying them. They're not for everybody. They do have some side effects.
Do you mind mentioning a couple just so people are aware?
The main side effects would be things like bloating, nausea, because part of the way that they work is they inhibit your stomach from emptying and helping you feel full faster that way.
Okay.
But that can be uncomfortable for some people. You also need to be on the medications for a long term in order to maintain them working in your system. So patients who have stopped these medications, they do tend to gain some weight back. So again, I think everyone has their own goals, and I would encourage everyone to talk to their doctor about both those medications and bariatric surgeries as options for them if they're interested in weight loss.
And I feel like an underlying theme that I'm hearing here is still lifestyle changes.
Absolutely.
That regardless of what option you choose, you can't see real lasting change unless you do some of the work.
Absolutely. And that's what we're good at as a bariatric surgery center, is that multidisciplinary approach, working with our nurse practitioners, dietitians, psychologists, in order to address what are some of these issues that patients may have, and coming up with a plan for long-standing lifestyle, dietary and lifestyle modifications.
Well, and having a good support system around you is invaluable as well. As we're in our last few minutes here, I believe Carle has a Facebook group for bariatric support. Can you talk about that?
Yeah, so we have our Facebook group that's run by our bariatric nurse practitioners. It's a support group for all bariatric patients who are on the journey, whether they are just thinking about getting bariatric surgery done, or they've had surgery 10, 15 years ago. And it's a community where all of our patients can come together and talk about their successes, talk about their challenges. We have patients who post different recipes that they do and that have really worked well with them, different workouts, or just a challenging experience that they're going through, and getting the support from the community. And this is our medical professionals are on there to kind of help guide the conversation. Now, this of course doesn't substitute for proper medical advice, right?
Absolutely.
By your nurse practitioner or your doctor. But it's good to have our medical team involved on that group as well, that can provide little pointers here and there and help people.
It's not like you finish the surgery and then it's like, okay, good luck. You've got some touch points in between those appointments as well.
Exactly.
We're about to wrap up our conversation, but was there anything that I didn't ask you about that you think is important for someone at home to know if they're considering either surgery or medication?
Yeah, I think just to know that that a lot of people struggle with excess weight. It's very common. And a lot of people have tried a lot of things over the years that may or may not have been successful. But we as medical practitioners, as bariatric surgeons, are here for you. I encourage you to talk to your doctor and consider these options, and which one may sound better for you. And definitely reach out and make that change if you're interested.
Yeah. And as we're in our last minute or so, are there any other success stories that come to mind that you think is worth sharing?
I think just the biggest success story is talking to patients 1, 2, or 3 years out, and seeing how they're able to play with their children, their grandchildren. I had a patient who came to me 2 years out and was so happy that she could sit on the floor and play with her grandchildren and get back up again. And just something that simple that a lot of people are able to do without even thinking about was a big win for this patient, and that really framed why it is that we do what we do, to help people in their everyday lives.
Excellent. Very well put. We've had Dr. Mohammed Elshamy with us here from Carle Health. We thank you so much for your time, and thanks for coming on Being Well.
Thank you so much. It's been a pleasure.
And we thank our viewers for joining us for this episode of Being Well. If you're after more information, you can visit Carle Health's website. And if you'd like to watch more episodes of Being Well, you can find those anytime on our YouTube channel. We'll see you in the next episode.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
This is you, and you are why we do what we do. Because the way you feel matters. Sarah Bush Lincoln, trusted, compassionate care.
Next time on Being Well. Whether it's arthritis, injury, or wear and tear, your joints tell a story. Sarah Bush Lincoln physician assistant Nick Williams shares how orthopedic care can help you move better and feel better. That's what's next on Being Well.